Hello and welcome to this video reviewing the label for XANAX. This is one of the most common benzodiazepine medications used today. And in this video, we're going to be going over all of the risks. So if you are thinking about taking this medication or if you are on it, you are fully informed of everything. I'm Dr. Josef Witt-Doerring. I'm a board-certified psychiatrist. I used to work at the FDA and I've worked in several pharmaceutical companies in different safety roles. I spend most of my time nowadays treating drug side effects, but also tapering people off medications. And so let's dive right in. First thing that you want to know about XANAX is the boxed warning. So the boxed warning here is the most important risks that every doctor should know and every patient should know. So the number one thing is that benzodiazepine medications like this one, when combined with opiates, have a synergistic effect. And they synergize together to increase the risk of sedation and respiratory depression. So when people take these two medications together, their chance of stopping breathing is really high and you can die from that. And you've probably seen stories in the news of people trying to buy Xanax off the dark net or people on the street, and it's laced with fentanyl, and you get this kind of double hit where people get both of the drugs together and it kills them. The second thing that you want to know is that benzodiazepines, just like Xanax, have abuse potential. People like taking them. There's a high to these medications, at least in the short term, where they induce a very comfortable form of sedation. And what we found is that people abuse these drugs. They take them, not as prescribed for recreational use. And so you want to be aware of that before you take this medication. And you might want to give it a miss if you have a history of using drugs to to cope with things, or maybe you use drugs and you end up taking more and more and more, and you've gotten yourself into difficult situations in the past. And finally, and something that's very close to home for me because I work in this area, is that abrupt discontinuation can be life-threatening. These medications need to be tapered slowly. At their worst, they can cause seizures, which really just cause an electrical storm in the brain, and sometimes people go into cardiac arrest, their hearts stop beating and they die. And so these drugs need to be tapered slowly. Indications and use: so it's been studied and shown to be useful in the short term for panic disorder with or without agoraphobia. And I say short term because it's fairly well known that for a large proportion of people, these drugs only do work in the short term. In fact, over time, a lot of evidence has shown that these drugs actually make anxiety worse over the long run. People tend to get obsessive ruminating thoughts after they've been on them for a while. So I don't think any doctors really recommend taking benzodiazepines long-term anymore, unless it's the only thing that works for you. So I'm now going to go into further detail for some of the warnings and precautions. So, we talked about the risk with opiates and the risk of abuse, but we really should go into more of dependence and withdrawal reactions. And so when you take a medication for a long period of time, your brain actually fights against it. It pushes against it, because benzodiazepines, they act on the GABA system, and that is the inhibitory system in the brain and in the body. And it has a whole role of physiologic functions. And so when you take something that's going to ramp up the inhibitory system, the brain is going to start getting messages that it needs to change itself so it can keep things in a balance. And that's what's happening with dependence. Your brain is kind of changing and you're getting used to functioning on that drug. And then slowly over time, you build a tolerance to it. And then you're not actually feeling the same effects. And you're not actually feeling the same effects because your brain has kind of changed to regain that balance. And so what happens with withdrawal is, if you just remove that drug really quickly without tapering it, you're going to remove it at a pace that's that's faster than the brain's ability to readjust for all of those changes. And if you've been taking this drug for, I would say, 6 months, a year, or several years, the best way to taper is going to be to do it over at least 6 months and go down very gradually in a slow manner. Because if you go too fast, cold turkey, rapid detox tapering in 2 weeks, you could have severe withdrawal symptoms. You could have things like seizures, and they're very uncomfortable. To me, the biggest risk, apart from dying from acute withdrawal, is actually developing something called protracted withdrawal syndrome. And this is when you develop severe withdrawal symptoms because you tapered too quickly, and but they don't go away when you go back on the drug. So no longer is it withdrawal, so to speak. It's actually a brain injury. It's a brain injury that was caused by overexcitation during that acute withdrawal. That's not recovering when you go back on the drug, and this can go on for several years. And so protracted withdrawal, it's really characterized by a few things: severe anxiety, insomnia, oftentimes agoraphobia. That's when you're afraid to kind of leave your home and be in public places. Some people get really afraid to be by themselves. Others have really loud ringing in their ears, and they become very sensitive to outside stimulus. And sometimes for some people, it's so bad that they start to pace and they develop something called akathisia. And this can go on for several years. And if you go on my YouTube channel, there's a lot of videos about protracted withdrawal. A few more things that we want to mention in the label. Sometimes benzodiazepines can make people feel more depressed. And so you really want to be aware of that. If you're taking this medication, you're feeling more depressed, you might be best coming off of it. And also in some instances, they have been known to cause mania, but usually how this is described by doctors is causing paradoxical reactions. And so people take them, and instead of being sedated, they become more agitated and restless. And you just need to know that the drug, in very rare cases, can do this. Something really important for women to know, especially women who are thinking about having falling pregnant while they're taking the drug, is that this drug is teratogenic. It's associated with birth defects. So you really want to avoid benzodiazepines at all costs while you're trying to get pregnant or during your pregnancy. Also, after pregnancy, XANAX is available in the breast milk, and there have been reports of infants showing more signs of sedation when they're feeding from women who are consuming benzodiazepines. If you're an elderly person, you want to be particularly cautious using benzodiazepines because the sedation that is inherent with all of these medications, like XANAX, is going to be more pronounced in the elderly people, and they're going to be more at risk of things like falls. And finally, a little word just about the clinical studies that got these drugs onto the market. They were 6 weeks long, and so that is the duration that we looked at them. So really, the efficacy of these drugs after 6 weeks has really not been studied in a double-blind, placebo-controlled trial. And so I know a lot of people take these drugs very long-term, but they're really doing it kind of off-label. What we do know about this class of medications is really that you should not take them any longer than a month. Ideally, you don't take them any longer than 2 weeks, because by that time, you're starting to already develop a dependence and a tolerance, and it becomes harder and harder to come off it. Also, by about a month, that's when you start seeing people who start to develop actually worsening anxiety on the drug. So who should really be taking this drug? I can think about a couple situations where it's really good. So let's say, for instance, if you're going into a surgery, taking XANAX is great. Getting an MRI because you're claustrophobic, it's great. Taking XANAX when you need to go on a long flight overseas and you're afraid of flying, that's great. And sometimes just taking XANAX as a one-off for acute periods of stress and anxiety, if you're only using it like once a week or something like that, that's okay. But just know having it around is kind of dangerous because, man, the drug just works. I've taken XANAX before. I know it hits, and it's very easy to want to take more and more of this drug. Another instance where it might be okay is if maybe you're going through an incredibly stressful period, a divorce, loss of a loved one, and there's just this really short kind of time frame for maybe 2 weeks where you need to be on something. It's okay in those situations, but you just need to be really strict that after those 2 weeks you come off it, because honestly, this is one of the hardest drugs to stop, and it can be really dangerous.